Hi, I'm here today with Jeff Labers, who's the head of 3M ESPE Corporation, and Ron Ballard, Tim Thompson from IMTEC Corporation, and we're here actually at a fantastic event that Jeff has put together and his people called Expertise, where we have minds and brains of people from all around the world discussing the latest technologies. Thank you very much, Jeff. And Ron and Tim are from IMTEC Corporation, which is not a well-known name right now, but it will be shortly because there's been a convergence of companies here. So for starters, Tim or Ron, I'm aware of IMTEC as far as a company that makes mini implants, and you also have the Illuma cone beam CT, but I'm sure there's a more robust bag of tricks that you have. Would you care to elaborate?
Well, I think IMTEC really comes from a genesis of two different groups. Ron formed IMTEC about 15 years ago, and that's a mini dental implant and an implant company. And I formed a company called Hi-Tech out of Los Alamos, New Mexico. And so we have quite a wide array of digital dentistry components in industrial and computed tomography that we have brought together for the dental industry. And I think that's why Jeff and 3M are so excited about the mix, because with the mini dental implants and implantology, we've really created a powerhouse of technology and implant technology.
You know, mini dental implants have become the standard for general dentistry and implant dentistry. And one of our goals at IMTEC was to enable general dentists through digital technology to be able to perform additional procedures that they didn't already perform in their practice. Mini dental implants, through the addition of our DigiGuide system to guide them on where to place the implants into the patient's jaw, is a very important part of the future of our company. In addition, we have a product called the Grobet Tray, which is ideal for enabling general dentists to be able to properly place brackets from a Illuma CT scan. So I think 3M and IMTEC have a lot in common, and we have a lot of goals to grow our business in dentistry through digital dentistry.
Well, Jeff, as a visionary, you brought on digital impression systems, now you brought in this whole ball of wax. What was the reasoning behind all this, and what do you think this does for 3M in encompassing all of the products, all the technologies now? What would you say?
Well, the whole scope of dentistry is going to change, and change, you would argue, for the better, in terms of enabling technology that drives not only patient treatment, but patient planning. And I think with the inclusion of IMTEC, which we're thrilled about, the opportunity to have this now really elevate the opportunity to understand what you can do with the data, whether it be for patient treatment and planning, or then ultimately with the type of device, whether it be indirect or direct or implant or anything along those lines. Tremendously elevates to make dentistry, we think, ultimately for the patient, a much better experience.
That's fabulous. And if I can be so bold as to know, we've recently acquired the Bronte's company, which is now Lava COS, which does intraoral scanning of crown and bridge. Right. And now we have the cone beam CT superimposed over this, so there could be a convergence, there should be a convergence at some point of all those technologies, allowing us to perform dentistry at a much, much higher level than we've ever been able to do before. That's my feeling. The other thing is that 3M, as far as I believe, 3M hasn't really been in the implant business at all.
No.
And this opens up, I think, the vista right now in the world, certainly the US, but the entire world. Implants have become extremely popular as a restorative process. It's actually become first-line defense for a dentist now. So this is going to open up a whole new world for 3M to be working with the restorative end on that. I think if we combine the COS system, this system for treatment planning, implant planning, we'll be able to embed some of these impressions. All of a sudden, we'll have totally impressionless systems. Patients will have the best treatment, and it'll probably lower the cost ultimately to the patients. That's my feeling. So with this merger of technologies, how do you see this in the big picture of dentistry? And what is this going to do for the world of dentistry as you see it from 3M standpoint, 3M ESPE standpoint?
Mm-hmm. Well, we believe fundamentally the end-to-end solution is much clearer with the combination of these companies. And we think ultimately the benefit, again, for the patient is that they'll have a more complete, arguably faster, better resulting treatment planning process from this. I think that we would say that from the industry's perspective, it's going to probably spur a lot more collaboration, which we think is to the betterment of everyone. In addition to the merger of these two companies, we continue to work on partnerships with other companies as well, and we anticipate other companies doing the same for the sole purpose of really trying to understand how you can combine assets for the betterment in terms of dentistry.
And as 3M has proven, we're having so many varied parts of the company. You can take from here, and join forces with technologies and everything thought you had available at your fingertips.
Definitely. And I think the convergence of these technologies is going to be very important. Equally important, though, is using this technology to enable practice, as opposed to just a theoretical discussion of it. And I think what we're going to see now is really a rapid change in terms of the enabling of the technology as opposed to the theoretical discussion.
That's great, thanks a lot.
Thank you.